Hello, my name is Kory Baker, and this is my fetal pig dissection for Miss Segraves A&P 1. Now, the first structure of the pig that I'm going to point out is the pinna, which is the external ear. It channels sound waves into the ear canal. Next is the eye, which is the organ responsible for vision. Next is the nares, or the nostrils. It's a paired opening to the nasal cavity for passage of inhaled and exhaled air. Next is the tongue. It is a muscular organ in the mouth that aids in manipulation of food. Then you have the shoulder. It is the joint where the forelimbs attach to the body. Next is the wrist. It is the joint of attachment of the foot. Then you have the elbow. It is the joint on the forelimb at the junction of the humerus and radius and the ulna. Next are the teats. You can see them right there. They are paired mammary papilla, or the nipples. Next is the umbilical cord. This is right here. And is tissue that connects the fetus to the placenta. Next, you have the knee right here. And is the joint on the hind limb at the junction of the femur, the tibia, and the fibula. Then you have the foot, and is the portion of the hind limb distal to the ankle, or of the forelimb distal to the wrist. Then you have the ankle. It is the joint attachment of the hind foot. Then you have the tail. It is a posterior appendage. And then all right here, you have the head. It's the most anterior region, contains the brain, mouth, ears, and nose. Next, from this region to this region, is the thorax. It is the body region between the head and abdomen, and it contains the lungs and the heart. And then from this region to this region, you have the abdomen. The more caudal of the two regions of the trunk contains most of the reproductive and digestive organs. Then, all right here, you have the forelimbs. It's the anterior pair of legs. And then back here, you have the hind legs, the posterior pair of legs. Next, back here, you have the genital papilla. In female pigs, a fleshy flap that loosely covers the urogenital opening, which I believe we have a male here. And back there, you have the anus, which is the terminal opening of the digestive system through which digestive waste is eliminated. And since we have a male, we have a scrotum instead of the genital papilla, which the scrotum is the sac that holds the testes and the epididymis outside the male's bodily cavity. Okay, now that I've tied the pig's legs back and opened him up, I can point out some of the structures on the inside. Right in here, where my middle finger is, you have the thyroid gland. And this gland produces hormones important in metabolism, growth rate, calcium levels, and development of the skeleton, muscle, and sex organs. And then right over here next to it, you have the thymus, which is the immune system organ in which T cells mature and differentiate. Now, down here below it, you have the pericardium. It is a sac of specialized peritoneum that encloses the heart. It contains pericardial fluid. And then, right here, you have the heart. And the heart is the muscular organ that pumps blood through the body. Okay. Then right here, where my pointer finger is pointing, is the lungs. Lungs are the respiratory organs of gas exchange. Okay. Then right here where my pointer finger is the liver. And the liver is an accessory digestive organ whose function include the fat digestion and storage, bioproduction, glucose metabolism, and detoxification. Okay, and then back here where my pointer finger is again is the stomach. The stomach is the muscular chamber of the digestive tract that holds and churns food, mixing it with various digestive enzymes. Okay, then back here, where my pointer finger is the spleen. And the spleen is an organ that filters and stores blood. It's the source of the red blood cells in the fetus. Okay. Next, down here, you have the large intestine, or the colon. It's the site where feces is formed through the absorption of water from the remains of undigested food and the action of intestinal bacteria. Okay, and then to the left of it over here, you have the small intestine. It is a long convoluted tube of the alimentary canal extending from the stomach to the large intestines. Okay, and then this vein right here coming off the umbilical cord is the umbilical vein, and it transports oxygenated blood to the fetus from the placenta. Okay. Next, we have the kidneys, which is right here where my pointer finger is pointing. And the kidneys are an excretory organ that removes metabolic waste and produces urine, also critical in maintaining the balance of ions in the blood. Next is the pancreas. Okay. Next, the pancreas is the accessory gland with a endocrine portion that produces insulin and glucagon, and a exocrine portion that produces digestive enzymes. Next, down here, is the urinary bladder, and it's an expandable sac that stores urine before it's released through the urethra. Okay, and then right here, you have the umbilical arteries, and they are vessels that transport the oxygenated blood from the fetus to the placenta. This completes my fetal pig dissection. Thank you.